I think healthcare is good at running to the problem, and I do think that in 5 years we're going to look back and say, wow, this was really a difficult time, but out of this grew the motivation and the necessity to change, and we're going to see real change. And how we think about the delivery of care, aided by those two huge kind of positive momentum factors, I think is going to give us the opportunity to do something really special in healthcare if we've got the courage to lead.
Hey everyone, it's Arick Wierson, and welcome back to yet another episode of Leverage Storytelling, brought to you by Tunheim. I'm here with James Hereford from Fairview. How you doing?
Doing well. Thanks for having me.
Thanks for coming on.
Yeah.
So James, the whole mHealth Fairview issue has been, obviously covered amply, I think, in local media for sure, and in healthcare trades. But just to sort of level set here, why don't I give you the floor and talk a little bit about kind of where the status of all that is. Obviously, there's been, like I said, a lot of coverage about that, but just I think we want to talk more about storytelling, but why don't you just talk a little bit about that to start off with?
Sure. So Fairview's had a long relationship with the university. We acquired their hospital in 97 when it was in some financial distress. And over that 30 years, the relationship really grew and built, and most of that relationship is really with the faculty practice, UMP. And so the whole kind of AG intervention inevitably led to, well, for this to be stabilized, we have to have a relationship between the faculty practice and Fairview, because that's kind of the nature of the dynamic. And so we were able to do that in a fairly short order. And I credit Greg Bielman, who is the CEO of UMP, with that. But we were able to come up with a pretty detailed binding term sheet, and then turn that into a definitive agreement. That made it much easier in the conversation with the university. We came up with, I think, reasonable solutions with enough detail that getting to definitive agreement shouldn't be all that difficult. So it'd be nice to be able to now focus on the market and our patients and our communities, as opposed to the ongoing drama that has surrounded this over the last few years.
What did you learn about controlling the narrative during the as this whole sort of situation played out? Like, what did you learn about sort of corporate storytelling?
Well, I think it's important that you are clear about who you are and tell that story, right? What do you stand for? What's important? What's motivating? What are the key things that you feel like you have to be able to do? And, for us, I've got 35,000 employees. I got to bring them along on that journey. And so, it's got to be meaningful, authentic, that people, believe the source of the information. And then rationally, it's got to make sense to people, right? One of the advantages I have in my organization is, I am surrounded by a bunch of really smart people, and they can smell BS a mile away. And so it's got to, it's got to resonate. It's got to be accurate. It's got to be something that they can get behind. And it's got to, appeal to the heart.
So what's next for Fairview now?
Well, the biggest thing for us is, I think that there's obviously multiple next things, right? You've got the basic blocking and tackling of the core business. The challenge, especially in Minnesota, but not only in Minnesota, I think it's more broad-based in that, is this Jenga tower of healthcare financing that we put together is simply breaking down, right? People keep taking little blocks out, and at some point it's going to tumble over. And, we've been doing cost shifting in healthcare for the last 50 years. And that is putting too much stress on commercial entities who have to pay more to make up for the governmental side that doesn't match costs. That's not going to work. And so from my perspective, we've got to get a lot of things done operationally. We'll continue to look for opportunities to grow organically. But we have to find a new path, specifically for Minnesota, but generally in the U.S., because the way that we built healthcare financing won't last.
Right. And what else?
Well, so the biggest thing for us too is diversification. The problem with, as essential as the hospital and healthcare delivery business is, it is it's a 1% margin business in a world where healthcare in and of itself, hospital business, you need at least a 3% margin on your net operating income just for capital replacement purposes, because we run big, expensive buildings with big, expensive equipment, and big, expensive people. That problem isn't going away. And, we have opportunities. We're really good at specialty pharmacy management. And in fact, we spun out our capability into a separate entity that we can now sell across the country and are having pretty good success with that. But the core business has to work because, if you have a heart attack, a stroke, you want that ED open 7/24 by 365, and we have to be there for our patients and our communities.
As you look across the healthcare landscape and particularly primary care and specialty care, are there different organizations around the U.S. or even around the world that you're benchmarking off of, or do you feel like kind of everyone's in the same boat at this point?
No, I mean, you see one healthcare organization, you've seen one healthcare organization, and they all have, various strengths and challenges. If you're looking at those organizations, like the Kaisers of the world, Geisinger to a certain extent, what they've been able to do is, I think, impart a path for all of us. And those organizations have to do that because of their business model. And that's one of the fundamental issues of financing in healthcare is they actually get paid for delivering great care. I don't, right? I get paid for delivering more care. And the system is not set up to get in to be, focused on prevention. Well, we've got to attend to
people
that.
have been talking about that in healthcare for a long time. This idea of value-based care.
Oh God, yes.
But it's really been a lot of lip service, right? I mean, there really haven't been some sort of seismic changes since people started talking about this. Maybe you disagree. But.
No, I think that's exactly right. And so, when people say value, you got to dig in and say, okay, what exactly do you mean? Because when a health plan typically says, oh, we're going to pay you on a value basis, what they're really talking about is taking our medical loss ratio, which is what they already pay, maybe add a couple of points to it, keep their 15 cents on the dollar, and put me at risk for the money they're already paying me. And that's value? No. True value is how do we think about that premium dollar in full across the continuum of care to have its greatest impact? There are very few relationships outside of the truly integrated systems that have achieved that. Health plans don't want to do that, and understandably so. They make a lot of money. And I'm hoping, the biggest purchaser of healthcare is the federal government. Not the most innovative entity in the world, but that really could be the place where we do true value. And there's a lot of well-meaning experiments, but we're not where we need to be in terms of really a comprehensive approach to kind of changing the way that healthcare is financed.
To the average consumer, the average American, still healthcare is this big enigma. They know it's expensive. They know it's necessary. They don't understand why it's getting more expensive. And particularly when they look at, next door in Canada or things in Europe, is it a narrative problem in some respects, or do you think it's the underlying issues need to be fixed before they can start fixing the narrative?
No, this is a systems problem, right? People should be frustrated with the cost of healthcare. If you recall the Economist article from fall of 2023, now that was one of the better pieces that anybody has done about the nature of the U.S. healthcare system, because what they showed was, we often in hospital systems and healthcare systems get pilloried for driving up costs. We're about half those costs, and I get that. But the other half is in the middlemen. It's in the health plans, the PBMs, the distribution companies, pharma, et cetera. The average margins for the other half that's not, I would argue, not creating a tremendous amount of value is 15 to 20%. Average margin in a hospital system, healthcare system, is under 1. So yeah, it's expensive, but I would go to where the money's being made if I were really going to think about how do you reform the system? And God knows, hospitals and healthcare systems have plenty of opportunity to improve, to get more efficient, more effective. But it is the place where people treat it like a utility. They expect that hospital to be open 7/24 by 365. And those are very expensive places to run to meet that need. And that's the advantage that systems like Canada or almost any of the OECD countries have an approach that is systemic. Doesn't mean it's perfect by any stretch of the imagination. They still ration care. The way they ration care is by wait times. The combo systems like the Swiss system or the Australian system where, yes, there's a layer of public, but there's also a layer of private. So if you want to buy up, great, do so. But anybody has access to high quality primary care and necessary specialty care, that's a right, not something that you have
Do you
to have
feel it
privilege.
runs into sort of resistance because there's a certain segment of the population that sees that as sort of socialized medicine?
Yeah, of course. Or either socialized medicine or differentiated medicine for the rich. Well, we've got to get past those platitudes. We've got to get down to, okay, let's be honest about what really drives the system, what the system needs, and what the relationships are between the pieces of that system.
And where do you think the solution starts?
Well, I think it almost has to start at the federal level, just because of either through the purchasing power or the power of the regulatory kind of environment. But I think enacting whatever that framework is going to be a state by state interest. And I hope Minnesota might be the kind of place that would be able to come together and say, you know what, there's a better way and we can find it. We've enjoyed really great healthcare in Minnesota for a long time. We shouldn't be complacent about, are we just going to rest on our laurels? And the nice thing about Minnesota is at least people will talk to each other for the most part. They may not like each other. They may not agree with each other. It's easier here than if you're in California, both by scale and by attitude.
Do you feel there's an opportunity for Minnesota to sort of lead the nation in that conversation?
God, yes. I mean, in many ways, we're perfect. We're the right size. We're not too big, not too small, right? Metro and rural, we're kind of the perfect complement. And we've got there's a certain special sauce in Minnesota, right, about who we are and a pride of being Minnesotan. And I do think we can leverage that to come together. And we can provide leadership that's badly needed in this country.
And what do you see your particular role in that conversation, in that movement? How do you see yourself playing that out?
I think part of it is, there has to be a certain amount of stretch towards, target actual gap. Please explain, right? We've got our actuals today. We've got to start to talk about the necessity to change and to resist the status quo, to reject that. And it's been an industry that really hasn't driven a lot of change for itself. And, I think one is using the organization that I lead as a place to demonstrate real change. And, you look at what we've accomplished over the last, 4 or 5 years, it's hard to argue that we haven't achieved real change. The next step to that is saying, okay, now can we use that platform to say change is possible in healthcare, and here's what we've got to do together. But you look at our marketplace, the Twin Cities marketplace, Hennepin's borrowing money to make their payroll. Alina lost $100 million again last year. North is in serious trouble and looking to find somebody to acquire them. UCare is no longer an entity. This market is in trouble, and out of that distress could come real opportunity to come together and talk about, well, what could we do differently?
So let's end on a more positive note then.
Thank you.
Silver linings. What do you see in these difficult situations? You obviously sort of have a generally positive outlook. I think you seem like someone who's more of a glass half full as opposed to half empty type of guy. What do you suspect might happen, say, in the year ahead?
Well, I think crisis often raises the bar for a lot of people. It brings people to, especially in healthcare. We're at our best in healthcare and in a crisis.
Do you think that, by the way, just to interrupt you quickly, do you think that COVID, at the end of the day, it was terrible. Lots of people lost their lives, et cetera.
Yep.
But do you feel like what that forced the industry to do had some long tail sort of positive repercussions?
I think it certainly had positive repercussions for my organization, because what it forced us to do is really accelerate becoming a system of care, not just a collection of parts. Right. I think it exposed our public health system as being woefully inefficient and insufficient in many ways. I think healthcare is good at running to the problem, and I do think that in 5 years we're going to look back and say, wow, this was really a difficult time, but out of this grew the motivation and the necessity to change, and we're going to see real change. And if we didn't have anything else going for us, that would be hard. I think AI is going to be a game changer. I think precision medicine, we don't talk about precision medicine much anymore. It is exploding. And the whole field of understanding of genomics and how it intersects with overall health and specific disease states is expanding significantly. How we think about the delivery of care, aided by those two huge kind of positive momentum factors, I think is going to give us the opportunity to do something really special in healthcare if we've got the courage to lead.
James, thanks for coming on the
Eric,
show.
great to see you, man.
For Leverage Storytelling, I'm Arick Wierson. We'll see you next time.